Good afternoon, Durham. I'm Jenkins, Director of the Durham County Department of Public Health. Vaccines have been the biggest headline in COVID-19 news this week. So today's message will address some of your common questions about this, which will be critical for stopping the spread of COVID-19. When will the vaccines be available? As stated in Governor Roy Cooper's message this week, the state hopes to receive the first shipment of vaccines as early as the week of December 14th. Who will receive the first vaccines? The first shipment to arrive will be prioritized for healthcare workers who are on the front lines helping COVID-19 patients. Staff and residents at long-term care facilities will also be prioritized for early shipments of vaccine. This is part of the state's plan of a 4-phased vaccine dissemination. You can find this plan by following the link shown on the screen. On page 61, you'll find a table outlining each phase and who is included. You can use this table to see which phase you'll be in to receive the vaccine based on factors like your age, your job, and your health risk factors. Where and when will vaccines be available to you? For now, vaccines will be sent to hospitals and local health departments to give out to those who qualify in the first phases. Eventually, as more vaccines become available, it will become even easier to find a vaccine location near you, like your local pharmacy or doctor's office. We know many of you are wondering when vaccines will be available for you in the phase you're in. There's no deadline or definite answer to this question right now. Timing will depend on many factors, including how many people must be vaccinated and the number of vaccines that will be available. So stay tuned to guidance from the state as more information becomes available in 2021. Finally, maybe the biggest question on your mind is whether these vaccines are safe. Durham, I want to assure you that these vaccines have been developed by teams of experts and were thoroughly evaluated for both effectiveness and safety. These vaccines have been tested on tens of thousands of human volunteers who were closely monitored to ensure safety. These vaccines have withstood rigorous testing and evaluation in order to reach the final stages of clearance by the Food and Drug Administration. I understand your concerns about safety of these vaccines, and I know I couldn't possibly address them all in one video, so I encourage you to visit the CDC's vaccination page, where you'll find lots of information about how the vaccines work, why they're important, and how to trust that they are safe. This page can be accessed at the web address shown on the screen. As more and more rumors spread about these vaccines online, please be sure to follow accurate sources of information like the state and the CDC. Durham, I can't overstate this. These vaccines will be absolutely critical for stopping the spread of COVID-19 in our community. We simply cannot put this pandemic behind us until we all get vaccinated. While we wait for vaccines to become available, we can't afford to slack off in our COVID response. We are continuing to reach record highs in numbers of new cases and hospitalizations. Nationally, there are now 2 COVID deaths per minute. While we can't put this pandemic completely behind us until we are able to get vaccinated, we can significantly reduce how many people are impacted by this virus. We've done it before, and we can do it again. This will be especially important as we are still in the midst of the holiday season, and holiday travel and gatherings can become quick COVID super spreader events. It is still too soon to know exactly what effect Thanksgiving has had on our total case numbers, but we know that our choices then, now, and in the upcoming holidays will affect the health and safety of Durham County. So please, stay at home as much as possible, and if you have to go out, remember the 3 W's. Wear a mask, wait 6 feet away from others, and wash your hands often. I know you're tired of hearing it, but I repeat it because we know from evidence that these steps help protect us all. The end of COVID-19 is in sight, Durham, but we have to work together to reach the end with as little loss of life as possible. Let's continue to make the urgent choices to take care of ourselves and each other. We can do this, Durham.